Hi everyone and welcome again to this very short episode of Facebook Live which we are going to have today. So what we are going to understand is what are we supposed to do when we do not form embryos. All right. We all know that when we are doing any form of IVF or ICSI, formation of embryos is actually an age dependent parameter. So one of the most important things that we need to understand and we need to look into such situations is what was the age of our patient. Remember, once the age of the patient exceeds 40 years, that means somebody crosses the age of 40 years, or the AMH value is less than 0.5 when we look at a very low AMH value. These are two situations where an formation of embryo can be compromised. You can expect a compromised embryo formation in approximately 10 to 12% of these cases where the maternal age is more than 40, that means the age of the female partner has crossed 40 years, or the AMH value is less than 0.5 irrespective of the age. That is one thing which is extremely common. Let's assume we don't have these parameters. Let's assume the husband is normal, the wife has absolutely normal parameters. What do we do in that situation when there is no embryo formed? If you have assessed that your laboratory conditions are good, that means your incubator is good, your stimulation protocol was good, then one of the most important things which you should look inside these embryos is fragmentation. Though we think that fragmentation is something which can get corrected, less than 20% of fragmentation can be called as normal fragmentation, and these embryos also give rise to successful pregnancies and a successful blastocyst formation rate. What is important is that if a fragmented embryo has got arrested, that means there was probably some problem in the patient. A patient factor, if you've eliminated your laboratory problems, that is one of the most important things in such type of situations. The other thing which is very important, which you should understand, is that we believe in such type of cases, time-lapse imaging is an extremely good thing to do for the patients. Though most of the clinics don't have the facility to do this, but when you put these embryos in time-lapse, you will understand how they are growing. You will be able to annotate these embryos based on your criteria. You will be able to present a picture to your patients as to why their embryos did not form, or as to why they formed only one embryo which was not of good quality. In all these circumstances, time-lapse imaging is something which is beautiful. It is expensive, as we all know, but it is highly recommended for people who have not formed embryos, for people with low AMH, or for people who have an advanced maternal age. In all these three conditions where we are expecting people to not form embryos, probably time-lapse is the way forward. It really helps you in counseling these patients. And now the final thing. When somebody does not form embryos in a particular cycle, does it mean that this patient, somebody who has all embryos arrested at day 3, does it mean that these patients need to go for third-party reproduction? Does it mean that these patients need a donor sperm or a donor egg or something like that? The answer is no. What embryos you got is from a particular cohort of oocytes which you have retrieved in a particular month, right? It's highly possible that in the next month you are going to get a separate cohort of oocytes, a separate cohort of sperms which will end up in embryo formation. Unless there is something which is grossly compromised in the egg quality or in the sperm quality, things like this usually don't happen. You can also consider very strongly to change your stimulation protocol in such type of patients. And simultaneously, even if it is a good AMH, these patients can go ahead with something called as a double stim protocol, which we predominantly use in low AMH. Trust me, the luteal phase oocytes, the cohort of oocytes which you get from the luteal phase is beautiful, and you will have a lot of good successful embryo formation outcomes in these patients. On an average, we do entertain around 5 to 7 such patients every month who have not formed embryos at a particular place, at a particular clinic, which is okay, which is normal. You must give this a very deep and a profound thought, because usually just by tweaking the protocol here and there, we are able to form embryos in patients who have not formed embryos before in more than 90% of the cases, and almost less than 2% of the patients end up then requiring donor gametes. Any further questions on this, I shall be happy to answer. You can post it on the Facebook group or on the comments, and I shall be very happy to answer them and get back to you. Thank you.